Have you ever wondered why you're always thirsty, or why you're urinating more often? These seemingly innocuous habits might actually be your body's way of waving a red flag. Are you curious to know more? Well, these could be early signs of a condition called diabetes. Diabetes, a chronic disease that affects millions worldwide, often begins subtly. Imagine an uninvited guest that creeps into your body, causing havoc silently. That's diabetes for you. A condition where your body either doesn't produce enough insulin, or it resists insulin. This vital hormone regulates the sugar in your bloodstream, and without it, sugar levels can spike, leading to serious health issues. Diabetes comes in two main types. Type 1, an autoimmune condition where the body doesn't make insulin at all, and Type 2, where the body doesn't use insulin properly. It's a global concern, touching lives across continents, cultures, and age groups. Often, the initial symptoms can be so mild that you might not even notice them. Now let's dive into the top 10 symptoms of diabetes, starting with the first 3. The first symptom we're going to discuss is excessive thirst, also known as polydipsia. This happens because of the high sugar levels in your bloodstream. Your kidneys are working overtime to filter and absorb the excess sugar, and if they can't keep up, the extra sugar is excreted into your urine, dragging along fluids from your tissues. This triggers more frequent urination, which may leave you dehydrated and hence feeling thirsty more often than usual. Speaking of frequent urination, that's our second symptom. Known as polyuria, it's a direct result of excessive thirst. The more you drink, the more you need to urinate. But it's not just the increased fluid intake that leads to this. As we mentioned earlier, when your kidneys can't keep up with the high sugar levels, the excess sugar is excreted in your urine, leading to more frequent urination. And then we have extreme hunger. This might seem counterintuitive, especially when you're eating regularly, but here's the catch. In diabetes, your body isn't able to effectively use the glucose from your food for energy due to problems with insulin, a hormone that helps glucose get into your cells. When this happens, your cells become starved for energy, leading your body to signal for more food, causing you to feel hungry all the time. This condition is also known as polyphagia. In a nutshell, these first 3 symptoms, excessive thirst, frequent urination, and extreme hunger, are your body's way of responding to the high blood sugar levels caused by diabetes. These symptoms are closely interconnected and may often occur together, creating a cycle that can be hard to break without proper treatment and management. So, if you're always thirsty, urinating more often, or always hungry, it's essential to take note. These could be your body's way of telling you that something's not right, and it's time to seek medical advice. Remember, early detection is crucial when it comes to managing diabetes. Moving on, we have 4 more symptoms that you might overlook. Let's dive right in. First up is unexplained weight loss. Now you might think losing weight without trying is a good thing, but when it's unexpected, it can be a cause for concern. Here's why. When you have diabetes, your body can't effectively use glucose for energy. Instead, it starts burning your fat and muscle for fuel, causing you to lose weight. This can happen even if you're eating the same amount or even more than usual. So, if you've noticed a drop in your weight without any changes to your diet or exercise routine, it might be a good idea to check in with your healthcare provider. Next, we have fatigue. We all get tired from time to time, but persistent fatigue is something to take note of. When your body can't use glucose as energy, it leaves you feeling tired and worn out. Think of it as a car running on empty. Without fuel, it simply can't go the distance. The third symptom on our list is irritability. You might wonder, what does my mood have to do with diabetes? Well, fluctuating blood sugar levels can affect your mood. When your body's energy levels are low, it can make you feel irritable or more stressed than usual. So if you're feeling cranky and can't quite put your finger on why, it might be worth considering if diabetes could be the culprit. Lastly, we have blurred vision. High blood sugar levels can cause the lens in your eyes to swell, changing your ability to see. This doesn't mean you'll suddenly need glasses, but you might notice that your vision isn't as sharp as it used to be. These symptoms can easily be mistaken for other conditions, but when combined, they may point towards diabetes. Remember, early detection is key to managing this condition effectively, so if you're experiencing any of these symptoms, don't hesitate to reach out to a healthcare professional. Finally, here are the last 3 symptoms to watch out for. Starting off, we have slow healing sores or frequent infections. Now you might wonder, why would diabetes cause this? Well, high blood sugar levels over time can affect your blood flow, causing nerve damage. This damage can make it harder for your body to heal any sores or infections. So, if you notice that minor cuts and sores take longer than usual to heal, it could be a symptom of diabetes. Next, let's talk about frequent infections. Individuals with diabetes are often more susceptible to infections as high blood sugar can weaken the patient's immune system defenses. Furthermore, some strains of bacteria can thrive in an environment of elevated blood sugar. For instance, women with diabetes may experience frequent urinary tract or yeast infections. If you find yourself getting sick more often than usual, it's worth checking in with your doctor. Our last symptom is areas of darkened skin. This condition, known as acanthosis nigricans, is characterized by areas of dark velvety skin in the folds and creases of your body, usually in the armpits and neck. This happens because insulin resistance, often associated with diabetes, can lead to skin cells reproducing at an abnormally rapid rate. Now let's take a step back and do a quick recap of all the symptoms we've covered today. These include increased thirst, frequent urination, extreme hunger, unexplained weight loss, fatigue, irritability, blurred vision, slow healing sores, frequent infections, and areas of darkened skin. Remember, these symptoms can gradually develop and might not be immediately noticeable. It's like a puzzle where the pieces come together slowly and the picture becomes clear over time. That's why it's so important to pay attention to what your body is telling you. If you're experiencing any of these symptoms, it's advisable to consult a healthcare professional. You know your body best, and if something doesn't feel right, it's always better to get it checked out. Don't wait for all the pieces of the puzzle to fit together before seeking help. Stay proactive about your health, and remember, knowledge is power. So, there you have it, the top 10 symptoms of diabetes. These signs are crucial to watch out for. Understanding them can lead to early detection and potentially a healthier future. Stay vigilant about these symptoms. Take care of your health, and remember, early detection can make a significant difference. Thanks for watching.